name is Jon Lentz and I'm a pediatric orthopedic surgeon. I chose to become a doctor mainly because, number one, I liked working with my hands and wanted to find a way I could help people while also doing that. Pediatrics for me was an easy decision because I really like working with kids and I also like working with families. I think that kids have an innate ability to get better and heal really well and really just want to get back to doing whatever they want to do, whether it's playing sports or just going back to their normal lives. And I like being able to help them get back to whatever it is they love. I also enjoy working with families and trying to put them at ease in really stressful situations where their kids are possibly undergoing surgery or have broken a bone and are going to be in a cast or whatever it may be. Just explaining the steps along the way and coming up with a plan together with the kid, the family, and myself, and figuring out the best way to treat the patient. I was fortunate to have done my fellowship at Johns Hopkins, where I received, I think, some of the best possible training in spine surgery, sports medicine, especially in kids, limb deformity, and a lot of trauma, which I think is very beneficial. Altogether, it really shaped me into a great surgeon, and I've learned a lot in those situations and continue to learn every day as a surgeon. Seaview, initially it was about coming home for me. I'd been pursuing my career to be a pediatric orthopedic surgeon for about 16 years, living outside of New Jersey, and I'm from Lincroft originally, so Seaview was in Monmouth County, and of all the groups that I looked at in the area, Seaview was the one that felt most like a family to me. It was a big practice with a lot of specialties. I spoke with all of the surgeons in the group, and they all seemed to hang out with each other outside of work. They seemed to kind of work as a team and do cases together, and that's really beneficial to pull from different specialties to be able to really maximize what we can do for each patient. When I'm not at work, I try and dedicate most of my time to being with my family. I have 2 girls and 1 other baby on the way at this point, and my wife. Other than that, in my free time, I also love to play hockey. Anything really that keeps me active, whether it's exercising or surfing or snowboarding in the winter, really anything I can do to stay active. I really enjoy those things. One of my real passions is spinal deformity, things like scoliosis and kyphosis, which is something that develops in pretty much any age, from infants that are born with scoliosis or can develop through, especially in the growing phases of kids, which is when those type of deformities tend to worsen a lot. So I love screening programs, and I love making sure that our kids are getting into a brace, because the brace is one thing that can really prevent someone from needing surgery, especially with someone that's heading down that path that may be requiring a spinal fusion. We have a big practice with a lot of different specialties, and no matter what you need, we can help you, we can help your kids, we can help your grandparents, and we can kind of team up together when things are more complex to provide the best care for the patient.